Cool. All right. Hi, everyone who's joined already. We'll get kicked off in a few minutes. Welcome. Here we go. Okay, great. Hi, Lauren. Hi, Megan. Hi, Kendall. Jamie. Hi.
I think Lauren has a question.
Lauren, yeah, go ahead.
If you want to put your questions in the chat as well, I'm not sure if
Lauren, are you able to unmute, or otherwise feel free to pop your question into the chat? Or maybe it was just a hi.
Maybe. Hi.
Okay, we'll kick off in the next minute. Okay, great. Should we start? Cool. Well, welcome again, everyone. Really grateful to everyone who's joined us, and very excited about the topic for today's webinar. I was surprised to discover earlier this week that 40 to 50% of women, I don't know, Elizabeth, if this number is correct, but apparently 40 to 50% of women experience incontinence or leakage or some degree of pelvic floor prolapse at some point in their lives. And so it just made me reflect on how little I think still pelvic floor and pelvic floor dysfunction is in sort of mainstream health, women's health conversation. And yet, like, you know, so many other things that have to do with women's health, it impacts so many of us. So I think really important discussion today. Hopefully some great new things for everyone who joins to learn. I personally, probably for the first 40 years of my life, associated pelvic floor health with kegels. I think like many of us have.
Yeah.
And it was only a few months ago through a conversation with my GYN, who was talking about endometriosis and sort of ongoing treatment, and mentioned the importance of speaking with and having sessions with a pelvic floor PT, that I really saw this other side of, you know, pelvic floor and pelvic floor health. And so hopefully we'll delve into some of that stuff. And it's obviously part of the title of the talk. It's not just about kegels. And with that, yeah, really excited to have Elizabeth with us today, who's a pelvic floor specialist PT. Elizabeth, I love your videos, and I love the way that despite being an expert in the space, you also just make talking about it really approachable. Elizabeth has, prior to the webinar with us, had worked with Asma and our other co-founders previously with Olvi, and she has some really great videos up on our community. And so please do go and check those out. They are awesome and informative and calming. So please do go and have a look if you haven't already. And I think with that, let's kick off. So Elizabeth, myself, and Asma, my co-founder at Pandora Health, who's also a board certified GI, is going to be asking you, we'll be asking you some questions, and then we'll open the floor up for some audience and attendee Q&A. And then I know we're going to go through some exercises as well, which I'm really looking forward to. So with that, let me get right into it and ask you the first question, which is, what exactly is the pelvic floor? We've probably all heard the term. Again, we all have different sort of notions and connotations around it, but what exactly is it, and why is it so important to talk about pelvic floor health for women in particular?
Yeah, the statistic that you said that, almost half of women are, dealing with some kind of pelvic floor issue, especially leakage. Oftentimes people will come into my office for something else, and it's one of my questions that we talk about, and they'll be like, "Oh, well, yeah, I have leakage 'cause I had a baby," and so it's often, I say it's common but not normal, and I think it's become normalized a lot of the time, and so I always like to remind people of that there is definitely help at any age that you can get in the pelvic floor world. So what is the pelvic floor is a great question, because a lot of times that's a mystery to some. And I'll give you some visual aids today and try not to scare anyone with all of my props. But so pelvic floor, it's, these deep pelvic muscles and then there's superficial muscles on the outside. These muscles have multiple functions. The three major ones are posture and support with breathing. So they work right with the diaphragm. So when you inhale, your diaphragm goes down. We want the pelvic floor to go down a little bit. And then when you exhale, everything comes back up. And so that's why breathing is often part of the initial pelvic floor, get to know what's happening down there. So here's one thing that I learned from an opera singer who was also a PT that we can all try right now. If you do like a high pitched hum and pay attention to where your pelvic floor is, like where you're sitting on a bike seat, and you do like a, you'll feel the pelvic floor engage a bit. And then if you do a low pitched hum, you'll feel it relax. And so I use that trick with people who, a lot of times people come in and they have a hard time feeling where those muscles are, because they're, inside our body, and we usually don't need to know what they're doing unless we have something going on with them. So the humming can be really helpful, especially for people whose pelvic floor is resting a little higher. Doing that low pitched hum can help relax everything. So posture, but also sexual function. So arousal and intercourse, and then also bowel and bladder. So they let, the pelvic floor lets things out on that side. So that is the pelvic floor in a nutshell. And kegels were kind of like the only main thing that people knew about what to do with the pelvic floor. And over the past 5 years, I'd say, like the field has kind of exploded into, more functional based exercises and a lot more of how to manage pain and dysfunction in that area.
Thank you. Yeah. And I like that you talked about with the humming, at different ranges, and talking about the lower range humming and relaxing. Because I think, again, with Kegels, it's often, the conversation is often about tightening and contracting of the pelvic floor. And maybe we just talk about that a little bit, like, tightening versus relaxing, and also when do we think about either movement or exercises to help with either one?
Yeah. That's a great question, because that's another thing that oftentimes when you Google, like, what should I do for my pelvic floor? They say Kegels, your squeeze. And more often than not, it's the opposite that people need. A lot of times, especially with like the mind-body connection, people are resting. I use like an elevator analogy. We like to be resting at the lobby, and then to pee and poop, we have to go down to the basement. But some people are resting more at like the second, third, fourth floor. And so when they try to do kegels to help themselves, so like if you're resting up here and you sneeze, you know, your muscles are already being used, so you're going to leak. If you're resting up here and you have, you know, you're having pain and you're Googling, what should I do? And they're saying, do kegels, you're going to just be making it worse. So oftentimes people have to do the opposite of kegels, and that's like learning how to touch base with what their pelvic floor is doing throughout the day and learning how to relax it. So I think that is one of the most important points, that if you try to do kegels and they're not working, that doesn't mean that there's not room for help.
Great.
You know, that's a great, that's actually a great analogy, that elevator analogy. I've never heard it before, and I think it's super helpful for people to visualize what's going on. But so that brings me to kind of the second part of like why people come in. So there's people who are in different life stages, right? So there's people who are kind of in their, what we call their fertility stage, or they're having their menstrual cycles. And then there's people who are pregnant or postpartum. And then there's people who are perimenopause or menopause after that. Like, how do you put the pelvic floor differently in those people? Like, is it the same thing for everybody? Do you focus on different things for people like that? And should all of those people come in?
Yeah, that's a great question, because, you know, the young people that I usually see, the majority are pain. You know, pain with putting a tampon in, pain with sex, trying to have sex for the first time, can't tolerate it. You know, unable to have an orgasm, and just like you know, people don't talk about this stuff usually. I do all day, every day. Anytime you want to chat, let me know. But so there's a lot of education at all the stages, but especially in the younger population. Even how to put a tampon in. Like, I just got this new toy that I love because it's see-through, and so you can kind of see how things are stacked, like the bladder, the vaginal vault, and then the rectum. And so a lot of times people will, you know, when they start to learn how to put a tampon in, they're like putting straight up and then hitting a barrier, and like, I don't have enough room, it hurts, you know. And so just talking about like angles and where, you know, where parts of your body are on the inside can be super helpful. And then with pregnancy and postpartum, the muscles and the body have shifted. You know, there's gravity changing, the ribs expand. So there's a lot of like talking about pressure and muscle dynamics and stuff in that population, and weakness that can be postpartum, and sometimes pain in either of those spots. And then towards the perimenopause, menopause side, the tissues of the pelvic floor change and sometimes become thin, and sometimes there's pain and new problems that crop up, like constipation, sometimes fecal leakage or smearing, and talking about how the pelvic floor can, you know, you can do things to it to help.
That's really helpful. Actually, I didn't even realize, you know, that's a really good point about even when you're younger, just trying to figure out what, you know, these things that cause pain, like putting in a tampon and stuff, why did that happen? And that's a really big eye opener for me. One thing that I will tell you I don't do a good job of as a physician is sending more people for pelvic floor physical therapy. Traditionally, I always thought of it just like Aisha mentioned, like you're having leakage or there's certain problems. And I realized over time that, like my inflammatory bowel disease patients, for instance, they can actually really benefit from it. And when I had one specific interaction, I realized how we have to be mindful, even if you have another condition, that really you're focused on, the pelvic floor is still a big player in the body. And so you can't ignore that, even in the midst of another GI condition, whether it's IBS or IBD. So I think you're spot on. For GI doctors and for patients who are coming in, sometimes they come in for a specific complaint, for instance. Like, say someone comes in, and this is a lot of what who I send people in for, like constipation, and they have what's called dysenergic defecation, which maybe you can explain that, versus someone who comes in, for instance, from the GYN side, and they come in for some other gynecologic problem like vaginismus or some other kind of vaginal pain or something else that's GYN oriented. Can you tell us the difference in kind of what you would do for those two things? Because I think when a GI doctor sends someone, like, we have a very specific idea, and maybe you can also throw in kind of with biofeedback, because when I send people, we've traditionally been taught constipation, pelvic floor therapy, and biofeedback. And I'm not even sure what the GYNs send them for. I just know they send them for pelvic floor physical therapy. So this would be a great opportunity for me to learn a little bit.
Yeah. So it's rare that I have someone come in that it has like one isolated issue. Like, often as we're going through the history, it's like, oh, well, oh yeah, I have that too. And, oh, well, yeah, I've never tolerated a gynecology exam without pain. And they might be here to see me for constipation, but it's a very small area of surface area. So, and the same muscles are doing the opening and closing. So there's these loop muscles. There's one tiny one that goes just around the vaginal opening, and then this bigger one that goes around the rectal opening. But so I, in general, look at the same things, no matter what the diagnosis is, the same like general things in the beginning, like posture and flexibility and strength of the back and the hips and core. And then looking at the fascia and seeing if there's any like stuck spots that are causing any asymmetries or anything like that. And then depending on a person's comfort level, always, part of the exam, we actually take a look at what the muscles are doing. And that part is the part that generally like freaks people out. And they're like, I don't want to be here. I always like joke to people. I'm like, you look like how I look like at the dentist. Like, where you're just like, what's going to happen? So that's always within someone's comfort zone. Sometimes we don't do the internal because it's been a traumatic experience in the past. Sometimes we've like pushed that off to the next visit, or never even sometimes. But the difference, I think, in terms of how the initial evaluation looks and the education piece looks, is a lot of the habit type stuff that we'll talk about. So we talk about with the people that come in for GI issues, a lot of like nutrition, a lot of like toilet habits, like how they're sitting, not straining, making sure you have some kind of like feet elevated situation going on, because that helps put these muscles in a more slack position. And the other analogy that I really like to use is I talk about like the large intestine, rectum, as kind of like a slide. And, we want things to come down the slide and go out. So you don't want to hold on to, if you feel the call to stool, like you want to get there as soon as you can, because the more you hold it in, the harder the stool becomes. Like, the more dehydrated, the harder it is to get out. And then you run the risk of getting constipated or straining and that. And then the bladder is like a balloon. And a lot of times with like frequency and urgency and bladder issues, where people feel like they're running to the bathroom all the time or getting up multiple times a night, we're trying to teach the bladder, this is the bladder, how to expand and make more room and be less sensitive, essentially. So it's almost like the opposite, where with the bowels, we want to listen to them and they're kind of in charge more, and where the bladder is like, we're taking back, that tends to like control people's lives. And we're like, okay, we're going to work on, pushing out those intervals of when you're going, and like getting really to know, not going just in case, all of these different like little education pieces that can be really changing. Like, sometimes people will come back the next session and be exponentially doing much better just from changing some of those habit things. It's not all like the physical aspects of it.
Yeah, and so firstly, I love the use of props because I think, to actually see it and then see biomechanically how things work, just, it just feels different. And then you can kind of visualize these processes as they're happening. So I love that you work with these visual props. It just makes it so much more sort of real and tangible to understand. And then the other thing I was thinking about as you were speaking is just like being aware of what's happening in your body, which I think it can be so easy to lose touch of. And I know that this is something that you do in your videos and in your therapy, is sort of just this like body awareness, like feeling your body, what's happening in your body right now, being able to feel different parts of your body. And so I don't know if you want to sort of comment on that, just, busy woman, working moms, whatever, just this, like the importance of just being aware of where you are and how you're feeling and where your body is right now.
Mm-hmm. That is a great observation and something I talk about a lot. And I always encourage people to meditate. I think I'm getting like a little annoying about it at this point. I'm like, have you meditated? What's your plan? I kind of am like forcing people to tell me how they're going to work it into their routine, because exactly like up until last year, I was telling people to meditate because it's in all of the, pelvic pain journals. It's in all the like the GI journals where it's like meditation, it's free and it's so impactful. And then I started meditating daily over the past year, and it's wild. It's magic. And so I encourage people to find something to like improve that mindfulness, to get in touch with their body in a way that they take some 5-10 minutes a day to just be quiet and breathe and try to like clear their mind as best they can. And I think in the book Come As You Are, which I also recommend to a lot of my patients, Emily, the author, talks about how it's a practice and no one's perfect at this. And that was what resonated with me, because I think a lot of times we think we're not good at something and we stop doing it. And the cool part about the mindfulness and paying attention to what your body's telling you is, I was thinking about this today in the shower, like, then you get homework that you're like taking stuff away. Instead of adding more stuff to your like plate, it's like, you're going to stop clenching. You're going to stop clenching your pelvic floor. You're going to stop clenching your butt. You're going to stop, like, you're going to just, it's going to be easier to do your day, which is also really nice.
I love that. I love that. And I remember when I started meditation with a coach, and he said, when is the most relaxed you've been? And I said, it was on some beach on holiday. And he was like, the goal, and again, it's a practice. So it's not to, to try and, beat yourself if you're not there immediately. But the goal is so that during those 5 minutes, you get that feeling. And the sort of the all of the benefit of that holiday that you're not going to be able to go on every single week. So absolutely, yeah, totally agree. And then I wanted to ask a little bit about pain as well, because it's something that we talk a lot about with women's health conditions and with pelvic floor dysfunction. Some of the signs may be abdominal or back pain. Again, pain during intercourse, pain inserting a tampon. So yeah, maybe just talk a bit about sort of pain and how it presents, and maybe also, again, since we've gone down the woo-woo track, some of the psychology around, women dealing with pain and thinking that pain is normal, and the difference between discomfort, pain, and then something that is sort of, maybe it is normal, but normal versus right. So maybe speak a little bit about that.
Yeah, I think that's a great point, that a lot of times by the time people end up in a pelvic PT office, it's often after they've seen a lot of other providers. It's like, I've seen, GI, I've seen urology, I've seen my gynecologist, and like, it's kind of this, they've tried different meds, they've tried a bunch of different stuff, there's often like a feeling of being dismissed. And so that mindfulness connection with the pain is also something that's why that's so important, because when people really start paying attention to what their body's doing, they'll often come back and be like, I'm clenching my belly and my pelvic floor all day. Anytime I check in on it, it's like this. So a lot of times it's people are holding their stress in their body. And so getting that mindfulness there can really help to just paying attention and unclenching and doing that low pitched hum, changing positions. I give people a lot of different like yoga poses for homework to just kind of get aware of where they're holding that tension and where they have that tightness in the pain space. And then just the mind body connection. And so I talk a lot about like the vagus nerve and how, it comes down behind, the jaw and into the neck. So like jaw clenching, a lot of times it, can be a connection to the pelvic floor and unclenching the jaw. And then I teach people some like, there's like putting a little bit of like a minimum amount of pressure, medium amount of pressure, and just kind of stroking that area in a highly anxious situation can really help bring things down. And then I give people that kind of practice for homework. And then going back to the biofeedback question, so back when I originally started this training, it was like 17 years ago, that was a huge part of what we were trained in, was like biofeedback with a machine. And, you put little electrodes often externally, and then you can see what the muscle's doing essentially. And so a lot of times that would help people, like the visual connection of like, oh, we're trying to get the muscles to relax. And some people, that was when you would see the elevator situation where you're like, oh, you're resting really high. Or when I'm telling you, hey, like squeeze, you're relaxing. And then when I'm telling you to relax, you're squeezing. And that's kind of where you see that like constipation, confusion. It's like a muscle coordination issue. And so as the research has kept coming in the pelvic floor world, which is great, and it's a fun place to be because there's always new stuff. We've like moved away from the machine biofeedback so much, and more like stuff that patients can carry over more at home. So like mirror, like looking to see what's going on, still like a biofeedback, and you're seeing what your pelvic floor is doing, or like putting a finger at like the perineum area, and so you can feel when it's squeezing or relaxing. I'll have people sit on like a towel roll on the pelvic floor, so you can feel yourself like pull away and relax into it. And sometimes you'll see that like light bulb go off, and it's wild. Because again, some people go through their life and never ever even have to worry about what's going on in their pelvic floor, so they don't know where it is. Men have one. People just So
do you see a lot of people use like app-based devices, or there's like a lot of stuff out there? So the question is, what is the good stuff? I should say. Yeah, that's like the bottom line. Like what should we avoid and what should we use?
Right. I think, yes. So in the cases where we have someone who has an issue with strength, so this leakage has come on because their muscles are weak and or they don't really know where they are, and so they're not able to really like volitionally squeeze them. Like, so one of the things we teach people is like squeeze before you sneeze. So you can kind of counterbalance that intra-abdominal pressure and like make yourself a little barrier as you're sneezing or coughing or laughing. So if there's like a stress incontinence situation going on and the weakness is there, and those kind of apps with the home use biofeedback can be really helpful. The issue that I see with that is if a person's issue is because of that tension. So it's essentially like doing kegels, and then they're not going to really see improvements, and they're going to think that they failed. They tried it and they failed at it. And that's where that can get tricky to like, that's where I'm like, just go get at least an evaluation by a pelvic floor PT so you can really know what is going on with your muscles and your, posture and your breathing and everything.
And for that recommendation, to go and see someone in office and have an exam, again, thinking of my own experience, when my GYN recommended it, I was just like, oh, how do I find the right person? Like, who's good versus not good? Like, this is like such an intimate thing.
Yeah.
And so what would you say people should look out for? How to go about finding the right person? Are there any red flags to watch out for? And then as a follow-up, what can you expect from that first session? And are there ways to prepare yourself mentally or physically?
Mm-hmm. So I would ask how long the session is. That's one of the things. So you want at least an hour, and hopefully a little bit more. Sometimes people offer a little longer initial evaluations because there's a lot to cover. We talk a lot in the beginning, a lot of talking, which is, I think, really helps to kind of ease the, fear that, and like just anxiousness of what's going to happen. So a lot of talking, a lot of like, this is what's going to happen today, and, all within a comfort zone. So asking how long it is, you can look at a person's bio and see where they trained. And Herman and Wallace Institute is, and I can put these notes like in the after, we'll put them down. But the Herman and Wallace Institute is the big like pelvic training institute. So seeing where they trained, where they got their extra training, because in PT school, went to PT school for 3 years. I think 1 hour in anatomy class, they were like, this is the pelvic floor. And if you want to learn more about it, like, you'll have to figure that out on your own. So most PTs don't even have this knowledge. And so like the places, and there's a pelvicrehab.com where you can look up the pelvic PTs in your area, and it'll give like a little blurb about, what kind of training they have. And then the first visit is usually 99.9% of the time people leave and they're like, that was so much better than I thought it was going to be, which is always like a nice feeling. But most of the visit is, the beginning part is chatting, going through history, and that's where a lot of times we find other issues that are also there. Because if you're resting on the third floor, if your pelvic floor is tense all day, there's oftentimes GI issues and gynecology issues that are like pain based. And sometimes leakage on top of that, because the muscles can't function the way that they're meant to and responding to pressure. So like that humming and the, going up and going down, sometimes that's just hitting a wall. So, and then we look at like posture, strength, flexibility, looking at the fascia, seeing if there's spots that people can work on at home. I give people a lot of homework. Not a lot of homework, but like a few things. Not a lot. Oftentimes it's like, stop clenching, stop holding your breath, stop breathing like up here, just try to shift. Changing the way you breathe is very difficult. So I always let people know that it took me years to really pay attention and like breathe from the ribs, and we'll practice some of that in a little bit. But like sometimes I'll recommend cupping, which is something that people can do. I keep mine in the shower, lotion or soap, and then you're picking up the skin and gliding it, so that a lot of times it's like bloating and like lower belly discomfort. That can be really helpful to ease some of that pain, especially with any kind of like C-section scar or like abdominal surgery scars, there's a lot of like restrictions in scar tissue. And yeah, and we in the pelvic PT world have a lot of tools that we can recommend. But I like to assure people that we're not using them usually in the session. It's more like for home use. So you may see those kind of things on social media where there's like a pelvic PT showing like the wand, and then you're like, I'm not just I'm not going to. I'm not going to do that. But it's more like, okay, at home, you know, you can access these muscles on your own, because usually people, it's different than a typical PT where you're going like 2 to 3 times a week for a, you know, frozen shoulder or something. This is more like once a week or every other week. And then really a lot of the work is at home, is like day to day, daily routine type stuff. But like with the wand, you can get in and, you know, access those tight muscles on your own, so that if you have a flare up, you have the tools to help yourself, which that I think is like half the battle. When you feel like you're like helpless or you need to go see someone to help you, you know, just having that like people with chronic UTIs that end up being like muscle related, that, you know, the muscles were squeezing on the urethra, and so they were having that burning and frequency. And it turns out it wasn't chronic UTIs, it was a muscle issue. It's like, well, why does the antibiotics work some of the times? And I'm like, I think some of it might be you start taking the antibiotic and you finally like relax and you're like, okay, this is going to go away. And then your muscles relax, because when the pain starts, they're like at the penthouse. Yeah. And so teaching people how to help themselves, and so, you know, you'll see like the dilators online too, and that can be a little bit overwhelming. You know, this is when people are having pain at the opening or with, you know, insertion. And then you'll see people like have the stack of them, and then it goes all the way up to like the big scary size. So these are all usually like, sometimes we'll practice how to do it, and then you take it off to your own. And not everyone needs to have this big of a one, but we talk about what sizes people need. So a lot of education, a lot of like habits, and just talking about things that no one really ever talks about, like how you sit on a toilet, and you know, when you pee and how often, and that kind of stuff can be really helpful in those first visits.
I think this is so helpful. I feel like I should have taken notes from the very beginning, because I'm learning like things with every sentence that you're saying. So before we will go on to answer people's questions, and then demo just a few exercises I know that you said could be used. Can you just share 3 everyday habits that outside of the clinic at home that people can do to keep the pelvic floor kind of strong?
Sure. So I think these are more of like so the 360 umbrella breathing, working that into, even if you're just doing that with your meditation, can really help your pelvic floor to learn how to go along with your breathing. So basically it's like putting your hands on your lower ribs, and then feeling, when you inhale, you want your ribs to expand, and when you exhale, they come back together. And so paying attention that when you inhale and your ribs expand, thinking about what that pelvic floor is doing, and you want to have it feel like it lets go a little bit, and then when you exhale, it comes back up. And so that is one thing to just a few times throughout the day, once, twice, 3 times, just checking in and practicing a couple breaths. You can do it anywhere, in your bed, in the car, whatever. You're feeling how the muscle is responding to the breath. And then having a squatty potty or some kind of way to elevate your legs, because what happens with that is, I just remembered, I like visual aids, if you haven't noticed. What happens when you have your feet elevated, and why it's important, is because you have this puborectalis muscle that's kind of like a sling. And when your feet are flat on the floor, which a lot of the toilets now are like pretty high up. Like we just got a new toilet in our bathroom, and it took me quite some digging to find like a low toilet. I'm like, we have to have a low toilet, because when you get really propped up, your angle, that angle that the muscle is holding the rectum like up, so you have to like fight to get the stool over that ridge. When you prop your feet up and you shut down that hip angle a little bit, that muscle relaxes, and then it's like a slide. It can slide right down instead of like a twisty slide and having to like work for it. So a stool, or propping your feet up somehow in some like books or whatever. And then not straining is the other thing that straining can cause a ton of pressure on that pelvic floor area. So it can lead to a rebound effect where the muscles just like come back up, and then you have incomplete emptying with both bowel and bladder. And then also it can lead to the organs like prolapsing and pushing down through the sides of the vaginal vault. And then so like the bladder can come through, the bowel can come through, and then on the others, and the uterus can come down. So not straining. So those two, like with the stool and not straining, kind of go hand in hand.
That's interesting. I tell people all the time, don't sit for more than 5 minutes on the toilet. If you can't go, get up and then walk around. And actually at our big GI meeting, they just presented an early abstract of people who sit and watch, sit on the toilet for more than the recommended amount of time and read or watch social media or read a newspaper, whatever, have increased risk of hemorrhoids. So I think it really kind of tends to create these habits or create these conditions that also are other sequelae of pelvic floor related issues.
Mm-hmm.
So should we do some, and everyone feel free to put in any questions you have in the chat. We're like happy to take questions. I know, Elizabeth, you had some guided exercises that we could do to really give people an intimate kind of understanding of how to get benefits at home.
Mm-hmm. Yes. And quick about the not sitting for too long on the toilet. Yeah, I give that information too, because, that can lead to the risk of hemorrhoids and prolapse situation. And, try to get to the bathroom as soon as you can when you feel that call to stool. But if you lose it, you gotta get up. Then I give a couple like quick things that you can try, like walk around, do some, some kind of exercise for a couple of minutes can help stimulate the system. And then trying to get on some kind of routine where, I try to encourage people to do this in the morning, because usually that's when, things want to start moving and you're waking up and the whole system's waking up. But chewing, because that's something too that, with people drinking smoothies or like just grabbing coffee and heading out. If you're doing a smoothie, throw a couple like blueberries and strawberries in, so you start chewing, so that wakes up the whole digestive system. And then, just making sure that you're not sitting too long. And also, I love your tip about, I just listened to the full webinar that you guys did last week or 2 weeks ago. It was great. And the bidet, which I have ready to get installed into my new bathroom. So I've been recommending the bidet as well to people. Yeah, it's great.
I love how excited Asma was to hear you mention the bidet. She's, I think all of us are big proponents. Yeah.
Yeah, it's great.
I'll give a few seconds just to see if there are any questions. I haven't seen any in the chat, but does anyone have questions? Feel free to pop them into the chat, or to just raise your hand and speak. And then if we don't see any, we can jump straight into the exercises. Any questions? No. Okay, great.
Okay.
We also will we'll post the video in our community, and if anyone has questions, Elizabeth's also part of our community, and so feel free if there's anything that you think about afterwards, or if anything sort of strikes you as interesting or you want to delve deeper into it, please do pop a question or a note into the community channel.
Yeah, and I know also that Elizabeth does personal sessions, education sessions with patients and stuff. So if you have personal needs that you don't feel like sharing, you can reach out to us and we can connect you with her as well.
Yeah, definitely. Like I said, a lot of the initial work is education and kind of talking through routines and habits and stuff. So there is a virtual component that can be super helpful for people, and just finding out if your issues are something that would be beneficial to see someone in real life, and just getting a handle on what aspects of what you're dealing with could be related to the muscle side of things, can be really helpful. So the first one of the things I mentioned about the 360 breathing, but I just wanted to practice that a little bit because that can be super helpful. The vagus nerve, that's the nerve that is that rest and digest, that like parasympathetic part of our body. And a lot of modern society, we're getting stressed out about stuff that we see maybe in the news, or we're in traffic and someone cuts us off, and there's like that stress response where your sympathetic nervous system is like taking over. And back in the day, it would have been like we're running away from like a tiger or something, and then we either escape from the tiger or the tiger becomes dinner for the tribe, and then we can be done with that stress. Like it's like, okay, it got completed. Where nowadays there's not real, we're just like right on to the next thing, and so that can really build up in our bodies. And that's why this one exercise where you're really breathing into your ribs, the vagus nerve goes through the body and goes through the diaphragm. So when a lot of times people breathe, they don't really breathe into the rib cage, and it's more like coming in our chest or with just the belly. And so I used to kind of call it like belly breathing, but now I've kind of shifted to this like umbrella 360 kind of analogy, where you're thinking about that like an actual umbrella is like opening up in your rib cage, so that you can kind of practice feeling it all over. And so I have my hands on my lower ribs, and I'm going to breathe in, and I'm really going to try to not let my shoulders hike up. So I have people practice this in front of a mirror a lot of the time. So you breathe into your ribs and then exhale, and the ribs come back together. And your belly will expand with this. So you're breathing into your ribs and into the belly, and then we'll do that one more time. So you breathe into your ribs and then exhale. And if you pay attention to what your pelvic floor is doing during that, the goal is to feel when you inhale, it relaxes, and when you exhale, it comes back up. So I'll have people practice this sitting on a towel roll, like right where the pelvic floor is. So you'll kind of have, something here. So you can kind of feel yourself pull away from it and feel yourself relax into it. And just practicing that with the meditation, practicing that a couple times a day. A lot of times this is where people will be like, I'm clenched all the time. I feel my belly doesn't want to relax. My ribs don't want to relax. And I feel my pelvic floor, but it's just like sitting up. And so just trying to get that flow going. It can be hard to do. It sounds easy. And when I first started out as a pelvic PT, I felt really weird giving people homework that was breathing. I'm like, okay, you do this all day long. like you're coming to see me and scared and taking your time out of your schedule. And I'm like, okay, like you're going to breathe for homework. What? But I think now having more education on this and why it's so important, it can make a huge difference. And I've seen it happen for people where just like really paying attention to their breathing can change the whole game for them.
Can I ask a question about that?
Yeah.
Where do you put your hands, on your rib cage, below your rib cage? Like, where do they go?
So, right, like lower ribs. And you know what else I have people do? Practice what other position, because you want the air to come into like the lower ribs. That's where you want to feel things moving. I'll have people practice on their side, and sometimes put like a little towel roll under, or like a little pillow under the one side of the ribs, because then you can really feel that top rib cage expand. Sometimes that helps like click of where you should be feeling it. Child's pose, like the yoga child's pose, because then you're blocking the front, which a lot of us kind of breathe into just the front plane. You can feel it more in the back. That's one of the spots where it's kind of hard. And a lot of women, we tend to get like a stiff mid back. So this can, and especially people that are sitting a lot in the day and kind of like go, as the day progresses, just getting like more and more like hunched forward, practicing breathing into your mid back can be really beneficial.
Awesome.
Yeah. And then the other exercise, one of the things I find that most people can benefit from. So this exercise I will give to people who come in for especially like postpartum weakness issues, like fecal leakage or urinary leakage where it's a weakness issue. A lot of times we have a weakness in our deep core muscles, and like the six-pack abs, like the rectus abdominis, are the abs that tend to get a lot of attention and love from, a group exercise class or like an online program. You're doing things to try to get that like definition in the abs. And the muscle that can really help with pelvic floor dysfunction is the transverse abdominis. So this is the muscle that kind of wraps around, it's a thin muscle and it's small, and like in terms of width, like it wraps around right here and kind of goes right above the pubic symphysis and along the sides of the wall. And I think if I had to pick a favorite muscle, it would be this one, even though that's very hard. It's hard to do. I don't like to do it, but if I had to, because it has a huge connection to posture and breathing and the pelvic floor. And a lot of times it will just like automatically want to help out when you're doing the pelvic floor exercises. So you may feel it. So, but it plays a huge role in when you contract the transverse abdominis, the little tiny muscles in your back co-contract. So you're getting like support to prevent back issues in the future. The stronger you are with this, the better. So as long as pain isn't an issue, I want to just say that usually we'll work on like getting the pain stuff down and then move on to the strengthening stuff. So that, just a little warning. Okay. So transverse abdominis. So you find your little sticky outy bones in your hips. So you can do it in sitting, like you'll find your little sticky outy bone and then go like an inch in. And that's your So if you brace as if somebody was going to like punch you in the stomach, sometimes I would say to people, like you get jeans out of the dryer and they're too tight and you're like trying to zip them up. Like that's the transverse abdominis, that little like bracing of the muscle. And so you can inhale, let everything relax, and then exhale and brace. And if you feel there, you want to feel the muscle kind of like pop into your fingers a little bit. That's the transverse abdominis. So practicing that, just bracing at that transverse abdominis, can give you that like deeper core exercise support that affects your back, your hips, your pelvic floor, the whole system, and can give you like a little bit more control over things. So just bracing, holding it for 2 seconds and then relaxing. And then as that starts to feel like you have a handle on where it is and what you're doing, then you can start progressing that and doing, if you're lying down and you have your knees bent, you can do that bracing and then letting one leg go out straight and then come back in and then relax. So you're going to like brace, leg go straight, and then come back. And so you can progress through some leg movements with that transverse abdominis activation.
So how many, like, how often do you do this? How many minutes do you do this? Like, is there like a protocol?
Yeah. Usually with the transverse abdominis, I'll have people do those exercises like every other day for, 10 reps on each side with the leg one. So it's not a huge, that's the cool part about this muscle. That's probably why I like it so much, is it like is really thin and you can see results pretty quickly with this versus like strengthening like a larger like glute or bicep or something. It just like takes a lot more time to like build up and see real results. With this one, 3 times a week, like 10 reps each leg, and you'll start to notice that the ultimate goal is that muscle will start to kick in for you when you're reaching for something, when you're lifting. It's a support system.
Wow.
The idea that you're creating support and like help for the pelvic floor area.
That's amazing.
Yeah, so cool. I after my third child was doing crunches a few 6 months or whatever after having him, and I was horrified to see this bulge like all the way down my midsection, and I was like, what is that?
Yeah.
And I realized that I'd developed diastasis recti, and so needed to do different exercises. And I think that's such an important thing for all women, is like these exercises that you may think of as, helpful or making you look good. And, if you kind of have this blanket approach to them, may not necessarily be the right thing to work on, or may sometimes be exacerbating an issue that you don't know exists. And this is also where I think it's so powerful to have someone who is able to give you personalized advice and support.
And in Europe, after women deliver, they automatically do pelvic floor PT like in advance of anything. So I've had friends from Europe who come here and they're like, your American system is horrible. Like, yes. She put herself into her own pelvic PT. And I was like, what are you doing? And she's like, in Europe, everybody does this. Everybody just does it normally after they deliver. Like, she had found a pelvic PT, and I was totally shocked and amazed that like we're so forward in so many ways and yet so backwards in our thought process, which is actually one of the reasons we wanted to do Pandora, is because I think the traditional medicine structure is for men. Like, because if a man was delivering a baby, I bet everybody would be getting pelvic floor physical therapy.
100%.
Right? I mean, it's kind of crazy. Like, I was really literally in shock when I heard this, and I do this for a living. Like, this is like what I thought I knew stuff.
Yeah. Oh, if C-section, like a major surgery, and it's just like,
72 hours, you're out. Yeah. And then,
good luck. Yeah.
Right.
Yeah, that's why I am so excited about Pandora and the community, because there's always new stuff coming out. There's new research, there's new products, and it's really hard to like sort through all of the things, all of the supplements and things, and what we should be doing. So having a group where people are bringing ideas and different treatment ideas and things to the table as a community is really awesome.
I think also some of your videos that we have on our platform are fantastic, because, stuff like bloating that people don't realize has to do with like all of your muscles, not just like one, one focused area. Can just doing some of those exercises can be just a game changer. So thanks for doing all of that, because I think it makes a huge difference to kind of spread the word and educate.
Yeah. Well, thank you guys for trusting me with that project. That was like what sparked my, hey, I can do stuff on my own, and then like branched off into my own business and everything. So you guys lit that fire, and
I love that. That's like the best. That's the best compliment, because you can spread the word. I think, your training in Cleveland Clinic and stuff is just fantastic. So I think you offer like this really great perspective from a very place of like knowledge that I think you need to be very, these days on the internet, it's hard to sort through what's kind of, good and bad, which is another reason we wanted to use people that we trusted.
Yeah. Absolutely. Well, we've reached the hour. I just wanted to say thank you again so much, Elizabeth. We're really thrilled to have you as part of our community and part of our family. And I think, again, it's not, there's your expertise, but there's also your approach, which we absolutely love. I was hoping that we would see Betty today, but we didn't. So you've got to follow Elizabeth on social media to see her great anatomical bodysuit that you sometimes practice in, which again, like the props, just makes everything so sort of relatable and easy to visualize. But thank you again, super informative, and looking forward to the next session with you.
Thank you. I really appreciate it. I had fun.
And thanks everyone for joining.
Thank you all. And thank you, Elizabeth.